Hi, my name is Feng. Today I'm going to demonstrate IV insertion. For this process, I'm going to use a banana as my model, and I'll be also using my own arm to show you how I would choose IV insertion site. So I will start the demonstration with me entering the room and introducing myself and explaining the procedure. Hi, Miss Banana. How are you today? How are you? Okay. Do you have any pain today? If there's any pain, we'll go ahead and give her a pain medication first, so she'll be more comfortable during the insertion. Since she has no pain, so I'm gonna go ahead and explain to her the procedure. Miss Banana, your doctor has ordered an IV antibiotic. So for that, I will need to insert an IV, a catheter into your arm today. Is that okay? So I've given her the instruction, the doctor order, and then I have received permission from her to go ahead and start the IV kit. And so for the IV, I'm gonna go ahead and insert a catheter through your vein, and then I will secure the catheter in your arm, and then through the vein you will be receiving medication through there. Does it make sense to you? Okay, so please, you can ask me any questions if you have any, okay? And I'm gonna go ahead and identify the patient. Miss Banana, can you please tell me your name? So she said she's Miss Banana. And what is your date of birth? And can I please check your ID badge? Okay, this is her ID, and she is who she says to be. And can I please know if you have any allergy? How about latex gloves? So she says she have no allergy to latex gloves or any medication. So in a few minutes, we're gonna get started. So, okay, Miss Banana, I'm gonna go ahead and prepare it, okay? So I'm gonna go ahead and wash my hand. And for 20 seconds, I'm gonna put on a pair of gloves. And for this procedure, I have already prepared IV sterile field, and be right here. And I have a pair of sterile gloves. It comes with the sterile kit that is already there. I didn't touch. And for the IV insertion, I have selected the saline flush. So without hovering over the sterile field, I'm going to go ahead and open it and drop it in the IV sterile field. And I have also chosen a 20 gauge IV catheter because Miss Banana has a small arm and small vein. So I'm just going to open the package and drop it in the sterile field. And I also have chosen IV starter kit unopened. So I'm going to go ahead and open it and then drop it in the sterile field where I can touch it. And I also have IV extension kit. So I'm going to go ahead and just open it and then just drop it here. I also have a pen because later I'm going to use it for labeling my IV site. So I'm going to go ahead and change my gloves. I'll wash my hand for 20 seconds. Now I'm going to put on my sterile gloves by touching just the inside of the gloves. Okay, and then with the steel glove, I'm gonna go ahead and grab the other and then put it on. Now I can straighten it up. Now, I'm going to prepare the equipment. I'm going to go ahead and open the Turkiderm. And just dropped it there. And I'm going to open up the tourniquet. Just leave it here. And prepare the tape. And I'm gonna go ahead and test the catheter, make sure it works. Just gonna slide the catheter a little bit and see if it's still go in and out. So it's very smooth, that's very good. Now I'm going to connect the saline flush into the extension kit. Let's see. I'm going to remove all the excess air. Okay, so there's no bubble in there now, so I'm going to leave it attached. The next step it will be selecting IV insertion site. So let me see. I'm looking for a good vein and straight. So for this demonstration, I am just going to use my arm, and then I'm going to go ahead and apply the tourniquet about 4 to 6 inches above the insertion site. Just lightly. So, and then I'm going to ask the patient to pump the fist. So now you see the vein is already popping out, and then and I'm going to go ahead and check the pulse and make sure that I'm not preventing too much blood flow. Okay, so it's still sufficient, so that's good. So this is where I'm going to be using be doing the IV side. So now the actual procedure, it will be on the banana. As you can see, I am going to go ahead and apply it on about, again, 4 to 6 inches above the IV insertion site. Okay, so ask Miss Banana to pump her fist, and then I can see now there's a vein coming out, and I'm going to go ahead and pull back and see. Okay, this is a good, I can see a straight IV site, the vein for a good IV insertion site. So I'm going to go ahead and disinfect the area. Let's see here. I'm going to go ahead and open this and then break it. And then now to let it soak. And now I'm going to clean the area by in the circular motion from inside to out. So all right. Now I'm going to go ahead and toss this. Let it dry. So assume it's already dried. I'm going to go ahead and start the IV. So I'm gonna go ahead and pull the skin below the insertion site, so tighten it so I can see the vein better. So for this procedure, I'm gonna go ahead and insert it within about 10 to 15 degree angle, and then as soon as I go in, I'm gonna and then pull down and then insert it on a more level angle so that aligns with the vein better. And as soon as I see the blood flushing, and I will advance more. So I'm gonna go ahead and insert just a little bit, and then now I'm gonna draw back about with my index finger still there. I will draw back the catheter about 1/4 inch. Now I can see the blood return flushing, so I'm going to level it, and with my index finger advancing the catheter all the way in, okay, and secure it. And now I'm going to put my hand above the insertion site, and I'm going to disconnect okay, I'm going to disconnect the IV, the handle, and I'm going to go ahead. Okay, I'm going to toss this into the sharp container. Now I'm going to connect that. I'm going to connect the IV extension catheter without touching the connector. So just gonna go ahead and flush it so I can see that the saline had went in. So I will go ahead and lock it. Oops. Let's go ahead and lock it, and now I'm going to go ahead and okay, disconnect the okay, I go ahead and disconnect the saline, and I'm going to go ahead and tape the going to tape this. I'm going to go ahead and actually release. Go ahead and release the, well, actually, the tourniquet. Now I'm going to go ahead and tape it under and around and then tape it across. Now I'm gonna go ahead and put the Turcoderms on top. Oops, the other way. Now I'm gonna go ahead and secure the extension with another tape. And I'm gonna go ahead and label it July 27, and it's 2:30 p.m. and it's a 20 gauge catheter and then 1-inch length and then my initial. So I'm gonna go ahead and dispose all the equipment. And ask how is the patient doing? She's doing fine, and then the medication is okay. So we're ready to start the medication. So this is the end of the tutorial. Thank you.